Hey doc, I have chronic Lyme disease. What should I do? Well, there's different stages of Lyme disease. I call them phase 1, phase 2, phase 3, and they're defined by where the bacteria is, or in stage 3, it may not even be present anymore. So look at our courses on Lyme disease. That can be the most helpful. But in short, early acute stage 1, phase 1 Lyme disease is when it can be treated acutely with an antibiotic, the best way to treat and kill Borrelia burgdorferi. However, if it goes inside of a cell, now it's more difficult to be treated by an antibiotic, because once the bacteria goes intracellular, an antibiotic is not going to follow it, and it can continue to multiply in the cell. And even though an antibiotic properly administered may kill all the bacteria in the blood and the extracellular spaces, it won't kill any bacteria in the cell. As that replicates and continues to grow, it can now go outside of the cell and it can start to replicate. People get these chronic Lyme flares. Worst case scenario is phase 3 Lyme, where in that last stage it's an autoimmune disease. So now your body, your immune system, has made antibodies against your own tissue. In that case, it's a totally different ball of wax on how to treat it. You need to look at our autoimmune course, because in an autoimmune case, once you have self-antibodies, you can't be taking immune stimulants that are typically given for people with chronic Lyme. Cat's claw, vitamin C protocols, etc. cannot be used if you have an autoimmune disease. So if you do use them, you will kill that which you have antibodies against first, which would be your own tissue. And you'll think and be confused thinking you have a Lyme flare when you're actually just flaring an autoimmune disorder and destroying self-tissue. So it's a completely different treatment protocol. No immune stimulants. Looking for triggers that are stimulating immune responses. Cleaning up the gut. Cleaning up the overall health. There's a protocol to follow, and I recommend our autoimmune course, and you can find that at connorsclinic.com.